Hi guys, so in this video we'll be having a think about malaria, its diagnosis and treatment. We'll be specifically looking at areas where malaria is endemic. Here in this video you'll be able to see time and space interacting together. This video will also focus on the Sustainable Development Targets 3.3, 3.8 and 1.1. You should find out what these targets are. Endemic means regularly found among a particular population in a certain area. Here we can see the importance of space. In this case, Lake Victoria. Specific strategies are needed to fight malaria in specific areas. So, focusing in on SDG 3.3. By 2030, there plans to be a complete end to the epidemic of malaria, along with other diseases such as AIDS and tuberculosis. Malaria is often found in neglected tropical disease areas. There is also a link here to 3.8, universal healthcare coverage. To achieve universal healthcare coverage, including financial risk protection, and access to quality healthcare services, and access to safe, effective, quality and affordable essential medications and vaccinations for all. Later on in this presentation, we'll be looking at the importance of malarial medication and vaccinations, but these must be available to the local population at an affordable level. Part of the strategy is diagnosis. There are several types of malaria. It's important when developing any specific place-based strategy that you understand both the extent of the malarial infection and the specific type of malaria that's present. A combination of different strategies are required depending on the type of malaria and the amount of malaria that is present in a particular area. ACT therapy for malaria focuses on the combination of several drugs to treat the disease. The primary objective of treatment is to ensure a complete cure, and that's the rapid and full elimination of one specific type of malaria parasite. As we said in the previous slide, it's important that we establish exactly what type of malaria is present. ACT is not suitable for all types of malaria. It's important to ensure that this drug is used properly and correctly, both across time and space. This is particularly important because there is now an increasing trend towards the development of drug-resistant malaria strains. We can see in this map that in particular Central Africa and specifically Lake Victoria are an area with a disturbing level of elevated resistance to malaria medication. Thankfully, so far, malaria resistance has only been identified in two types of malaria parasites. Again, this emphasised the importance of identifying the specific type of malaria parasite that is available. Here again, we can see the importance of space. Developing even further the idea of space, case detection on malaria surveillance is also important. This consists of mapping outbreaks of malaria. This helps to make a focused approach in dealing with malarial outbreaks. Here we would reference in our examination essays how the disease spreads. When looking at surveillance of malaria, we're looking at both the type of malaria and the amount of malaria that is present in the population. Different strategies are required over space depending on the amount of malaria infection that is present and the specific type of parasite. Monitoring and evaluating malaria control programs is an effective way to prevent the spread of malaria. Remember, malaria spreads faster when there's a greater number of people in the population that carry the parasite. If we can keep the infected population below a critical level, then malaria will find it very hard to spread. The world's first malaria vaccine was available in 2008. This was focused on a specific place: Ghana, Kenya and Malawi. Combined with existing malaria interventions, such a vaccine could have a great potential in saving tens of thousands of lives in Africa. You will note that this strategy is in combination with other strategies. So, the World Health Organization is very clear on the control of malaria. It does require a multi-level approach. This approach starts at the local level and goes up to the national level. It involves the use of vaccines, medication, education of the local population, and preventing the number of breeding sites for mosquitoes. This is a multi-level approach. The strategy sets ambitious but achievable global targets, reducing malaria cases by an instance of at least 90%. Also reducing malaria mortality rates by 90% by 2013. There is also the intention to eliminate completely malaria in 35 countries by 2030. This is very important because the WHO wants to prevent the resurgence of malaria in all countries. This is achievable, but in no way, shape or form is an easy task. It does require SDG 16.8, which is the development of effective and accountable and transparent organisations and institutions. It also does have a cost, so we can look at here target 17.3, which is mobilising financial resources for developing countries. Specifically, many of the tropical areas that we find malaria have been neglected in the past. All countries can accelerate their efforts towards the elimination of malaria through a combination of intervention strategies, but these must be tailored to the local context. Ownership of the prevention strategies and leadership and participation of the local community and all stakeholders are essential in prevention and control of malaria. In addition, as we've seen before, there does need to be improved surveillance, monitoring and evaluation. Again, this will help to stop the spread of malaria across time and space. Hey guys, I hope you've enjoyed this video and it's helped you to understand how malaria can be controlled and prevented and the interaction between time and space. Also, we have looked at the importance of engaging with stakeholders and the importance of strong institutions and investment in disease control.